This is not a hypothetical book that you guys have. This is something that I've learned over 25 years in clinical practice dealing with couples. As a fertility doctor, all I see constantly are couples and the interaction that men and women have. So it's based on my 25 years experience, and I think you'll find it interesting. A lot of things that what inspired me to really write the book, in addition to I had some downtime. People say, well, why'd you? I had some free time, and my wife, who's here somewhere, said, why don't you talk to your son about sex education? Well, I have to be honest with you, I was thinking about that. No guy really wants to talk to his son about sex education. And I remember driving, we just went to see a Jet game. My son, David, is now 26. I guess he was 15 at the time. And I said, David, Mom said I need to talk to you about sex education. He looks at me, I look at him, the Jets just lost. I said, you have any questions? He says, no. I said, fine. And the truth of the matter is, what do you guys know about sex education? So when we tell parents, go talk to your kids about sex education, I'm very scared. Because in general, sex education means, how to prevent STDs and pregnancies. But what do you do once you're actually having sex? And what are the issues? So where do you learn what to do or what not to do, if you will? A lot of people get their information from Cosmo, right? The women here. Let me just see by hand. How many women are here? 3 guys raised their hands. Who's surprised? But that's where a lot of people get their information. A lot of it is wrong. I know because I gave a talk to them about 5 years ago. And I'm always on Cosmo and things like that, talking about the real sex education for adults. So when you get the book, read it. It's not what I was going to talk about today. I am going to talk about men's health. But it's very important to understand all the issues. Another person came to me today and said, wow, that is a great book. Because on page 10 it says how often couples should have sex, which is a very important question, right? How would you know? And based on studies, men who are about 50, on average, married men, have sex about 1 time per month. No. It's a 50, 1 time per week, which is interesting. And that's average. Now, who wants to be average? And it turns out that the more sex you have, the healthier you are, and the better the relationship. I always say that sex is the barometer of a relationship. Anybody agree with that? It's true. 10% agree with me there. The other 10% are looking the other way. So it's important to understand that sex is the barometer of a relationship. So that's why I urge people to understand about it. And a lot of women, one woman here said, I don't have sex, it's because my husband, whatever. She didn't go into too much detail. The truth of the matter is female sexual dysfunction. That means when women are not having sex very often, if you will, for a particular reason, and many times is a function of male sexual dysfunction. So important to understand. So if you're not having sex, think about why and read my book, and I think you'll get some information about that. All right, so let me talk about men's health. Is that a better topic? And we'll have, all right, for the women, let me just tell you, in the book we talk about, this latest book is about not just sex education, but about relationships as well. So, and one thing that's important when we talk about sexual issues that couples have, I would say at least 1/3 of the time there's a medical related issue behind it. There's something wrong. Either the man doesn't have enough hormones, the testosterone may be low, or some other factor like premature ejaculation or things like that. So it's very important. So I'm going to move on. Anybody have a question on sex education? You guys have any questions? Oh, no, I'm fine. Well, we're going to take some questions out there. So let's talk about men's health, because that's what we're here to talk about. That's what my company, Veru, V-E-R-U, is all about. And a lot of times, and the guys back there, I guarantee you're going to have questions, and I'm going to say things that affect each and every one of you here. What's interesting is that I had a show on the Howard Stern Network. Can you hear me? Anybody listen to my show on Howard Stern? Nobody really admits to it. The truth is, a lot of people were listening to it. It was the only men's health show on radio or on TV, period. Now just think about that. If you turn on TV, there's so many women's shows, and women know more about their health. Except when it comes to men, we really don't have any outlet, and we're not sure what to do. We don't even know what men's health is and how we even define it. But I have to tell you a statistic that really gets me not upset but jealous, and that's the Susan B. Komen Foundation. So why am I jealous of that? Well, they're all over the place, right? For breast cancer awareness, at the NFL, there's the pinking of the NFL, where everything is NFL. But it turns out, roughly, I'm going to give you some interesting numbers, that 1 out of 6 or 7 women will get breast cancer in their lives. Let's say 1 out of 6. Of the 1 out of 6, 1 out of 6 will die of breast cancer. Now that's a lot. Now, prostate cancer, is it more or less? Does anybody know? You're wrong. Close though. Only 3 choices.
Yeah.
Well, prostate cancer, 1 out of 6 men will get prostate cancer in their lives. Of those that get prostate cancer, 1 out of 6 will die of prostate cancer. So it's exactly the same disease. The only difference is when men get it and they die a little bit at an older age compared to breast cancer. And I think that's an awful thing, that we don't even know that prostate cancer is as prevalent and as deadly as breast cancer. So let's talk about different things about men's health. What is men's health? Does anybody know what men's health is all about? Because you hear it all over the place. Men's health, men's health. Well, men's health is what?
Longevity?
Well, longevity is the same for men and women, right? Heart disease, pretty much that's for both. But what do men have that's a little bit different? And this is where I'm going to tell you about symptoms that you guys have. 3 things. Okay? The thumb represents the prostate and the bladder. And what do I mean by that? Well, men go to the bathroom too frequently. I get that. How many people get up to urinate at night?
Not in a minute.
Not a minute yet.
Early.
Do you get up to urinate at night?
Not yet.
Do you get up? How you do? Okay. A lot of people here get up to urinate at night. And I will tell you right now, and we're going to talk about the other aspects, the number one reason that men get up to urinate is what? You know? What's that? Prostate? No, it's not prostate. Turns out people drink too much fluids. There's a whole issue about drinking, hydrating. And you always see people walking around with a drink. And usually when they're walking around with a drink and they come into my office, they're drinking way too much. The second aspect of it, of course, could be a bladder tumor, but what we think about is an enlarged prostate. Well, an enlarged prostate can actually cause you to go to the bathroom too much, or an inflammation. Now, the prostate itself, we just said prostate cancer. How do you detect prostate cancer? Well, a lot of times right now it's with PSA testing. Anybody heard about PSA? Anybody had an elevated PSA? You did, right? A lot of people had an elevated PSA. Are you guys scared about getting a PSA test? It's not accurate. Did you say that? Yeah, it's not accurate is correct. Well, it turns out I see a lot of people that have an elevated PSA. When they have an elevated PSA, they tend to go for a biopsy of the prostate, which can cause all sorts of problems. And a lot of people, when they have an elevated PSA, about 1 in 4 chances, 1 in 4 times, when the PSA is not that elevated, between 4 and 10, there's about a 1 in 4 chance that you'll have prostate cancer. 3 out of 4, you will not have prostate cancer. So how do you know what caused an elevated PSA, and people are not realizing this, is an infection of the prostate. Any person here that's having sex, chances are that you're picking up a bacteria from your partner. A urinary tract, you know how women have urinary tract infections? Right? How often does a woman have a urinary tract? It happens then. You ever had one? She's the one that never had one. Did you have one? Of course. Well, it turns out men have urinary tract infections at a similar frequency as women have urinary. So we call it prostatitis. Yeah, so it's quite impressive. So people start going to the bathroom too frequently, they may have an elevated PSA. So it's important to really determine whether that elevation is from an infection, inflammation, or an enlargement of the prostate. When people go to a doctor, now women have a mammogram, or what do we have? We have a digital rectal exam, which is really not the best test. That you don't like it. No, I do a prostate exam with 2 fingers, not 1. People ask me why, I say second opinion. Can't help it. That's things are tough in the office. Well, that said, what we do in my office is we do an ultrasound of the prostate, and it turns out, when you go to the doctor, they do a prostate exam, the prostate is as big. They have no idea. The internist for sure doesn't know, and many urologists do it, and they're not sure. But by the way, if that urologist takes his watch off, leave. So what we do is we do an ultrasound of the prostate to really measure the size of the prostate and to determine whether the prostate is growing which way. It's okay if the prostate gets large. It can grow from left to right, but when it grows from south to north into the bladder, that's when you can have problems. And that's when people go to the bathroom more frequently. So guys, when you see a urologist, make sure that you get a prostate ultrasound. Now, it turns out that in addition to the PSA being not specific, we don't really use PSA as much. We use the 4K score test. 4K stands for kallikrein. PSA is a kallikrein protein. So it's more accurate in detecting whether you have a significant chance of getting prostate cancer that will kill you. Because remember I said 1 out of 6 men who have prostate cancer will die of it, 5 out of 6 will not. So if you don't, so a lot of people are getting, diagnosed or biopsied with cancer that will not kill you. So we tend to use the 4K score test, which is a test that was developed by Opco Health by Phil Frost, if anybody is familiar with it. Very, very important. So what do you do now? I'm going to get to the other aspects, right? I'm still with the thumb. This is the penis, because guys really care about penis quite a bit. In fact, they think about penis all the time, right? We'll get to that, and of course we'll get to the bottom, which is the testicles, which is important for sperm and testosterone. So we're going to get to aspects that are very, very important. You look like you're going to arrest me.
Enjoying your freedom here.
Yeah, it's true. Let me just finish up with prostate cancer. As I said, it's a killer for men. One of the drugs that we have at Vero Healthcare is a chemotherapeutic, a taxane-like drug for people who have metastatic and aggressive prostate cancer. The difference with our drug is that it's a pill as opposed to intravenous. So look into that if you can. Also, I want to tell you, when people go to the bathroom too much, and if it is because of a enlarged prostate, people tend to use Flomax, tamsulosin. Have you guys heard about that? I bet you a lot of people here are on Flomax or tamsulosin. The only problem with Flomax and tamsulosin, by the way, it's a $3.5 billion drug, is that I hate using it and I refuse to give it to my patients because they faint. And patients are supposed to take it after they eat food. If you don't take it after you eat food, you faint. It happens all the time. And nobody listens to me. Except my wife listens to me. But nobody really listens to the doctors. They take it before they go to sleep, they urinate well, and then they faint. And a lot of people who are on it may be on Coumadin or a blood thinner. One of the products that Vero Healthcare has is a Flomax drug, tamsulosin, which has no food effect. So it's more of a stable absorption of tamsulosin. The truth of the matter is, I worry about it. There's reasons why people use Viagra, and it's very, very important to know that when you're young or healthy, you should have an erection that you don't need Viagra. However, when stress really enters the scene, like for example, if you get a divorce and you meet somebody new, or whatever the stress may be, then it's hard to have an erection when you're perfectly normal. So anxiety is a real problem. So Viagra, Levitra, all these things work fantastic if you don't need it, if the reason is because of stress. Very important to know. And I get a lot of questions from young people about that as well. About, how can I improve? I'm just too anxious to have sex. And that's true with very young people just starting to have sex as well. So it's very, very important. Okay, so I'm still on the penis. So what else can go wrong with the penis? Well, it could bend. Because Peyronie's disease. How many people have a bent penis? 2 people up there have a bent penis. You know what famous president had a bent penis? Bill Clinton. That's correct. How did you know that? It was not Monica Lewinsky. A testimony with, I'm blocking out her name. It wasn't Jennifer Flowers. It was the other. Anyway, so on testimony, she said, well, I know his penis was bent. And a lot of people have something called Peyronie's disease, which is a bent penis. And why would a man have a bent penis? Well, it turns out that it's just scarring. A lot of people, when they have sex, think about it, it's an athletic event. It's an athletic event. So it's like, the marathon lasts 4 minutes, by the way, max for you, right? We'll talk about that in a second. So what happens is you have trauma during sex. And who has the most trauma? Well, men as they get older don't have as firm of an erection. Can they hear me out there? Is it?
That's why the traffic officer.
all of a sudden it's quiet the whole day. I heard trucks, ambulances, planes. So men sometimes don't have a really firm erection, and they try to insert the penis at that particular point. And if you're inserting a penis that's not fully erect, you could have more trauma. So actually, I'm surprised that Peyronie's disease doesn't occur more frequently, but it is something that occurs. I see it in the office quite a bit. And there's new medications, there's new drugs for it, but it is a devastating disease. Now, if you have a penis that's bent like a banana, that's okay, that's acceptable. But if it's bent like the pool is that way, if it's bent like that, that's a problem. And people, I had one patient's wife said to me, if you don't, either you straighten out that penis or move my G-spot. Okay, so what else can go wrong? The number one sexual dysfunction in this country is what? Nobody knows this. Anybody know? The number one sexual dysfunction in this country or in the world? Who said that? Jonathan said premature ejaculation. Premature ejaculation is the number one sexual dysfunction. How many people have that? At least half of you have it. It turns out that how long are you supposed to last when you're having sex, if you think about it? What's that? A few hours. Are you by yourself when you're doing that? Because that person must be reading the newspaper. Few hours. Well, it turns out that the average intravaginal latency, what's that? He's Spanish. So 4 hours for him means 10 seconds. So hold on. So average is about 5 to 10 minutes. Between 5 and 10 minutes. That's how long a sexual intercourse actually lasts, based on studies. Not in Spain. No. Over there is 4 hours.